How to use Simplitude by Me for HIV self-test. Simplitude by Me is a simple, easy-to-use HIV self-test that screens the presence of HIV antibodies in 15 minutes. The test is CE marked and more than 99.6% accurate in detecting HIV antibodies, which have not been acquired in the last 3 months. If you think you've been exposed to HIV in the last 3 months, it is important to speak to a doctor or visit a sexual health clinic. Inside the box, you'll find a HIV self-test sealed in a foil pouch and a bottle of test fluid. You will also find instructions for use and a care card to support you before and after you do the test, and a discreet disposal bag. Before you start the test, unfold the instructions and read them carefully to get familiar with the testing process. Then wash and dry your hands to make sure they are clean. Before you open the foil pouch, check the expiry date to make sure it is still current. Massage your finger for 5 to 10 seconds. Make sure it is in an upward motion from base of finger to just under the area to be pricked. This will help promote blood flow to the area. Gently turn the green tab, take it out and throw it away. To prick your finger, press the grey button firmly against the side of your finger until you hear a click. It can only prick once. Then place your test in the space shown on the instruction sheet. To get a droplet of blood, massage from the base of the finger up just behind the prick site. Do not pinch your finger in front or to the side of the prick site, as this will reduce blood flow. If you don't get enough blood, wipe your finger and squeeze again until you get enough blood to fill the tube. Don't pick up the test, as it should stay on the table. Hold your finger in a downward position and gently touch the blood to the tip of the tube so that the tube fills with blood. It is important that the tube is full. If necessary, repeat until it is full. This will ensure the test has the correct amount of blood. Once the tube is filled with your blood, hold the test on the table and flip the blood tube over to the well until you hear a click. Check to make sure the blood has moved from the tube into the well. Then, add 4 drops of the test fluid into the well. Start your timer and wait 15 minutes before you read the result. Reading the result before 15 minutes could give you a false result. However, do not wait longer than 20 minutes. How to read your self-test result after using Simplitude by Me. Remember, the test should be done 3 months after exposure. If there's no line next to the C, even if there is a line against the T, the test didn't work. You need to do another test or go to a clinic for further testing. If a line appears next to the C, but no line appears next to the T, and you did the test 3 months after exposure, your test is negative for HIV antibodies. If 2 lines appear, one next to the T and the C, even if they're faint, your test is positive for HIV antibodies. As this is a screening test, it is important that you go to a clinic for further testing to confirm the result. Now that the test is finished, you can dispose of it by putting all the test materials in the plastic bag provided and placing it in a rubbish bin. To get support and stay informed about HIV and self-testing, please read the Simplitude by Me support card and go to simplitudebyme.com.